It is a web tool designed specifically for specialty providers and their patients to make understanding and paying for care easy and convenient. And we do that by offering clear-cut benefit details to the providers, as well as equipping them with the tools that they need to create customized cost estimates for their patients. And for our patients, they're able to see the cost of care and then also make actionable steps with customized payment plans and financing solutions. Well, hi, I'm Shielvonda, co-founder of BrightPay Health. And my co-founder and I understand wholeheartedly the impact that surprise medical bills can have on patients and their families. And that's why we set out to create a company that would empower 10 million patients to overcome this. So I'm Shielvonda. I have 14 years of experience in the healthcare industry. I have both a master's degree in healthcare administration as well as business administration, and I've managed upwards of 18 practices at one time. And with all of that experience and all of those expertise, I too have been impacted by a surprise bill. And through our research, what we found is that I am actually not alone. Medical bills and medical debt impacts 1 in 6 Americans. Medical debt is the most common past due bill there is, and it is the leading cause of bankruptcy. But there's also a provider impact as well. 40% of practices did not meet their 2021 revenue goals because of patient debt, and 49% of those practices also saw increases in days in AR as well. And what we found is that by offering both price transparency as well as cost estimation tools is one of the top recommendations for provider practices to actually overcome this issue. And so that is why we created the BrightPay web tool. It is a web tool designed specifically for specialty providers and their patients to make understanding and paying for care easy and convenient. And we do that by offering clear-cut benefit details to the providers, as well as equipping them with the tools that they need to create customized cost estimates for their patients. And for our patients, they're able to see the cost of care and then also make actionable steps with customized payment plans and financing solutions. And so what this does for patients is it really helps them to understand very clearly exactly what portion of a bill is their responsibility and why, and it empowers them with the tools they need to make the right financial decisions. And for our providers, we help to improve efficiency and really remove a major bottleneck in that process to help providers increase their revenue potential. This is a glimpse of our patient portal and some of the information that a patient has access to, including their deductible information. And this is a glimpse of our cost estimator. And so this is an example of what a patient would receive from a provider that gives them a clear-cut, itemized idea of exactly all of the items within a particular treatment plan that will be covered by the patient versus covered by the plan. We have determined that there are 6 major segments for which we're focusing on, which includes orthopedics, pain management, physical therapy, home health, chiropractics, and dental. We know that $1.97 trillion is spent in out-of-pocket expenses alone just from patients, and $394 billion of that is concentrated amongst these 6 target segments. And so that gives us about a $7.8 billion opportunity. And we plan to generate revenue by 3 different ways. First, we will have a subscription model for our provider practices to access the platform. We also have a strategic partnership with a finance company, which offers us the opportunity to generate 3% off of every loan originated from our platform, and then we'll also generate 2% from every transaction as well. And we know that there's a lot of competition in this space. And one of the things that really separates us is the fact that we offer both a transparency tool as well as a payment tool in one platform, and that we offer both providers as well as patient views. And so far, we have 13 committed practices with 7 paid contracts. We have onboarded 7 physician practices already that are highly engaged, and we have several referrals and current leads that we are nurturing. And we have done a lot in just 10 months of existence. We have a wonderful team behind us. Archie Otu has a background in computer science with a degree from Duke University, as well as he's by profession a healthcare actuary. And so we draw from his experience in health plan side of it to really understand the data that we have access to, as well as to understand exactly how we can really develop our product. Lisa Schock has 20 years of experience as a practicing provider, and she herself used to be a practice owner, so she understands wholeheartedly this problem and has really lent her expertise to help us think about about how we would develop our provider network. And lastly, we have Dr. William Peterson, who has over 10 years of experience as a practitioner himself. He's joined us full time to really help us develop our Florida market and to carve out our footprint. And with that, we're looking to raise $500,000 in order to really enhance our development and our technology and really grow our sales and marketing arm. And with that, I'm Shielvonda, co-founder of BrightPay. Thank you.
Paint the picture for us in terms of your long-term vision for the company. What does this look like? What kind of impact can you imagine BrightPay having and what do you imagine it can look like 3 to 5 years from now?
Yeah, thank you. Great question. So we're really starting out in the transparency space and the payment space. But long term, our vision is really to create a highly patient-centric platform that allows patients to think about the financial decisions that they make around their healthcare, very much how we think about our 401k and our retirement. So, scenario building and features that allow you to really say, I want to have, a little one in 2 years, or I know I'm going to have a hip or a knee replacement surgery when I'm 60. What does that look like from a cost perspective now when I'm 35 or 40? So we really want to build it out in a way that really supports patients thinking about healthcare and planning and financials in a different sort of way and more long term, and really give them the tools to own it as well.
Tell us about the experience that your users are having. You've got active users on the platform. Are you able to capture feedback from them and input, and what is their experience been?
Yep, we have 7 active practices on our platform since April 15th. And one of the wonderful things that we did with our implementation was we created a feedback loop and a dashboard for each practice. So every time they report a problem or an enhancement or a need or a want, we capture that so they can see it and we can see it, and we track that. And so they get to see ongoing what the progress is towards that. We have our first enhancement release June 1st, which is going to incorporate much of the feedback that we've gotten in the last 30 to 45 days from those practices. And so we continue to do that and stay very close with our providers.
Do you envision this solution to be applicable to chronic disease care costs as well?
Great question. So we hope over time, absolutely. I mean, our vision over time is that the patients really drive the segments. So we're starting with segments that we think connect, but over time we'll look at what other markets or specialties are within a particular care team. So yes, I have an orthopedic that's on BrightPay, but what other care providers does a patient have that they'd like to bring on? Maybe it's their primary care, maybe it's their cardiologist. And so how do we create an entire team for them around that? And so yes, we absolutely.
Does the provider need to participate for patients to use it? So is there an opportunity for provider agnostic solutions so patients can just estimate their costs and finance their bills?
That's an excellent question. So yes, we just met with our development team this morning, actually, because that is on our roadmap, and we're striving to get to that by end of Q4 this year. So right now it's a provider driven, so a provider has to push the cost estimate into to the patient. But by end of this year, 1st of 2023, it will absolutely be patient centric and patient driven.